There, this is Pam Perry. So, welcome to Speakers Magazine. So, today we're going to be talking with a speaker who just recently completed her TEDx talk. But that's not really like her biggest bragging, right? She's a mom of two children who have really pushed her into her current destiny and mission and purpose. And we'll hear a little bit about Dr. LaShardae. I knew I was going to say LaShardae Scott. And she's going to tell us a little bit about her why, her organization. She just won a lot of different awards. She's really forged a lot of partnerships in Ohio with a lot of leading hospitals and really a lot of things, just really talking about sickle cell for adults and for children. So we're going to bring her up right after this.
Are you ready to elevate your speaking career and be a part of a movement that amplifies Black voices? Speakers Magazine is your go-to resource highlighting top speakers, industry insights, and strategies to take your platform to the next level. Subscribe today and unlock the blueprint for speaker success. Visit www.speakersmagazine.com, the #1 magazine for Black speakers. Subscribe now and start your journey to success. Amplify your voice. Subscribe today.
And she is in there. Yes, she is. How are you doing, Dr. LaShardae? So you know what? I'm like, I was saying your name all day today. And so when I start introducing you, I was like, it's LaShardae. So yes. I love the name. I love the name. So you are in this issue, which is the current April issue. And you just finished your TEDx talk. But really, you're really pioneering change. And that's what the article talks about in sickle cell as an advocate and also to, I guess, give us a backstory of why you're doing this work. You were recently won, I want to say 40 under 40 award for, what was it, 40 under 40?
Yeah, so in Toledo, it's 20 under 40.
20 under 40. Okay, 20 under 40. And that was an award from?
Toledo.
Toledo. Okay. Mm-hmm. All right. So the city of Toledo. So that is, and a whole lot of other things as well. So give us a backstory of how all of this started and why you're speaking and getting on stages. And I want to say one of the things that how we got together is that my husband, who's on the board at Eastern Michigan University Alumni, he heard you speak and he said, wow, she is amazing. He says, she is amazing. I said, really? He says, yeah. And he doesn't say that a lot. He says, yeah, she was really, really good. He said, you've got to really. And so when you said, oh, well, I want to do this, he says, but after my TEDx talk, I was like, you got a TEDx talk too? I was like, okay. So give us the why of why you're doing this work and what did you start out thinking you were going to do before you kind of got into this?
So to be honest, my why started with my kids. So I have 3 biological children, a bonus son. So I have 4 boys, but 2 of my boys have sickle cell disease. So in 2015, that's when my life changed. It was the first diagnosis that I got with one of my boys with sickle cell, and then the other one was born in 2016. So, yeah, they're 16 months apart. And of course, it was
those, Irish twins.
Yes. Of course, it wasn't planned, but the reality is my life forever changed, and there weren't a lot of resources in Toledo area. I am actually a Detroit native, but I reside in Toledo. So I felt that if I wasn't going to get what I needed to come back home to find out, how to educate myself best, which is what I did. And then I enrolled myself back in school, and I've been working in this field ever since. So it just started off with advocating for Emory and Evan. And now I'm advocating for thousands of patients nationwide, honestly. Outside of Toledo, outside of Ohio, and working in the 11 counties that I work in, I also do things at a national level for sickle cell.
Wow. So Emory and Evan, they were born and you went back to school. What were you planning on doing before they were born? What was the goal? Like you went back to school and got like a PhD in this. Okay. So it's not like I'm going back to school for a couple of classes. This is like seriously research.
It's funny because my original goal was just to get my bachelor's. I was like, My oldest was 5, and he asked me, "Mom, where's your degree?" So, so I decided to go back to school, and I made a promise to myself that I was at least gonna complete my bachelor's. But
Okay.
as I got grounded into this work even more, and just realizing a lot of the barriers and gaps within the healthcare systems, along with parents and families not being able to reach those resources, I said, you know what? I have to get my master's. Now I have to figure out how to navigate the systems and, help families and patients really understand their diagnosis and how they can get the resources that they need to be able to
Mhm.
thrive and survive with this condition.
I
So
have
I
someone else here, Dr. Yeah,
a
Dr. Tippett. Yes. She says, I see you, Dr. Scott. And then
so
there's someone over here too as well. It says, okay,
per
Perez.
yes, thank you. So with that, that actually pushed me to pursue my doctorate because I was working with a hematologist, and he sits on my board for my nonprofit. But I was working with a hematologist, and he said, "LaShardae, you need to go apply to a doctoral program today." So
Hmm.
he kind of pushed that narrative, and I was just like, he said, "You're already doing the research at the hospital, so just go ahead and do it." So that is how I kind of fell into the line of going into the doctoral world. So I never had any indication that that was something that I was going to do long term. But here
Wow.
we are, and I don't regret it. I'm actually happy I'm able to amplify the voices of individuals and families that are impacted by this condition.
Hmm. Tanya Maddox says, this is awesome. So glad you are advocating for them. So give us a little bit of stats. It started out with your two boys, and they're about a year apart. And so now you start doing this research. I personally only know from my lifetime one young lady. Her name was Kimberly Bennett. She had sickle cell when I was in high school at Cass. And she was the only one I ever knew until my daughter started going to elementary school, and she knew someone else that had sickle cell. And that, so I don't know how many people, because I never did the research. But what I do remember is from the little girl Raven, who did have sickle cell, that when it was summertime, she would get really, really sick. And I couldn't understand like what is going on, with that she would get really, really sick, and she would even go into the hospital. My daughter was like freaking out, and the mother said, oh, she has sickle cell. So explain to people the stats about around that, and then what really is the I won't say the symptoms, but people just think like, oh, it's just like a blood disease, but explain some of the symptoms that people will have that have sickle cell.
So, for those that are watching, sickle cell disease is an inherited blood disorder that attacks the red blood cells, causing blockage in the vessels, which could lead to organ damage because the oxygen is cut off from tissues, as well as it can cause strokes, cause your
Mm.
eyes jaundice, and it could potentially lead to early deaths, depending on how severe their sickle cell is.
Mm-hmm.
But in the United States, 1 in 365 African American births are impacted by sickle cell disease. 1 in 16,300 Hispanic American births. 1 in 25,800 Asian Pacific and Islander births, and 1 in 41,800 non-Hispanic white births. So this disease impacts a multitude of people.
Hmm. But it seems like it's more the African American. People always associate sickle cell with African Americans.
Yeah.
Why do you think that is from the research that you've done? Why is it more prevalent for African Americans?
Well, we can take it all the way back if you really want to go there. So King Tut had sickle cell disease.
I didn't
Um,
know that.
yes, his parents outlived him. King Tut died when he was 19 years old. His
Hmm.
parents outlived him, and that's because the parents had sickle cell trait. So anyone that has sickle cell trait will never be able to contract malaria, and that's where this came from. It was
Oh.
to try. So when you put 1 and 1 together, you get 2. So that is how sickle cell came about. And then when we think about how people migrated, so we know, we're in Africa, anywhere there's melon. So that's why
Mhm.
Asians are impacted, Middle Eastern, Mediterranean descent, all of these people from sub-Saharan Africa, all these individuals are impacted. So that is where this comes from. But we also know because it disproportionately affects communities of color, there's less research, less funding, and
Mm.
then it's not seen as valuable as diseases that impact white populations.
Yeah, like cancer or heart disease and things like that, breast cancer, things like that. Okay, I get it. I had no idea, Dr. LaShardae. So we're talking with Dr. LaShardae, and she has a organization, and it is called Scott Center, OH for Ohio, .org. And it has a lot of her activities, her speaking. She's booking to speak to really educate people about that. If they go to the site, they can actually, scottcenter.oh.org, they can actually get on your mailing list or get more information on some of the research and some of the things that you're doing. What's like the main message, I guess, you want people to really understand? Because what you just said was really impactful, that because it is affecting peoples of color, then there's not as much money put towards the research. So, what is it that the message that you're really advocating for?
So lately, my main message is sickle cell does not discriminate, but our healthcare systems do.
Mm. I love that. That is so true. So people can really understand that if you have like sickle cell walks or do fundraisers or just raise awareness of things like that so that people can thrive. Even it's not a death sentence when someone has sickle cell. Because
Right.
obviously I was telling you about the person with the high school with. She's now like almost 70, 65. So basically, she's been thriving her whole life. There is just seems like a lot of times it it because there were resources that aren't available or not spoken about, people don't really know how to help people that have sickle cell. What are some of the services that your organization provides?
So we definitely do anything through and through advocacy wise, but we also do a lot of education outreach
Mm,
events. And then we're doing a lot of workshops pertaining to transitioning, or we just had some because this is April is Minority Health Month in addition to Financial Literacy
yes.
Month.
Yes.
So we held a lot of workshops and did a lot of collaboration. I'm very, very big on collaboration because there's strength in numbers and a lot
Mhm.
of things intersect. So we had one where we focus on domestic violence and sickle cell, and you'll be surprised how many numbers across the board actually correlated with one another.
Hmm. What
Yeah.
so people who so give me that correlation.
So
Why do you think that it's
we
yeah.
know that we know so there's high numbers in domestic violence that fall in the Black population as well as Hispanic population, and those populations are impacted by sickle cell disease as well. I
Mm,
gave you the numbers on that earlier.
mm,
So
mhm.
it's just being able to see that even though there's two different situations going on, there may be some intersect, because who's to say a person that's thriving and surviving with sickle cell is not in a domestic violence situation where someone is withholding medication from them, knowing that that's their
Mm,
lifeline because they didn't
mm.
do something for that partner.
And
You
then
know,
one of the people that you're also a member of the National Association of Social Workers,
yes,
as well. And that
I'm
is
a director here in Toledo.
yeah, yeah. So you're a social worker by trade. That was the career. And then from there, really going into the nonprofit, I guess you would say the nonprofit leadership role of really starting the nonprofit. And then, with the research with the PhD. Was there something else that you decided that, like, even before you became a social worker, that's something that you said, I think I really want to do this when I grow up?
I wanted to be a teacher, and essentially, I am. I'm a professor at a couple universities, but I wanted to be a teacher, a secondary education teacher.
Yes. And that,
Yeah,
and you know what? It's kind of like a calling. So once you're a teacher, you're always a teacher. It's just depending on what you who you're teaching and what you're teaching. So that's really like the main thing. There's some people over here that Dr. Scott, she says, Hip says, you are a wealth of knowledge. That is one of the things she said that he says. I'm sorry, I'm saying she is. It's he. A lot of letters behind his name as well that I don't even know what those are, but he says that you're a wealth of knowledge, and it sounds like he has a lot of knowledge as well. And one of the things too, you hold a degree from Eastern, which is what I was saying that where Mark heard you speak as well. And
too.
oh yeah, that was too okay. So I'm looking at it here, and it's like, but
I'm alumni.
so you did your TEDx in Lima, Ohio, and that was just recent. So tell us a little bit about how that came about and why that was a goal, I guess you would say.
So I have been trying to do a TEDx since 2020. Um,
Mhm.
fellow colleague in the sickle cell community, Dr. Z, he did one in Detroit. And
Okay.
ever since then, I was like, I have to share my story. I have to share my story. But I believe in timing.
Hmm.
And obviously, God didn't feel that it was my time because I literally would miss the application deadline or I found out about it last minute. So this go around, I just so happened to be up on my computer working as I always do. It's around 2, 3 o'clock in the morning. And I came across the application for Lima and I'm like, oh my God, it's the power of we. And all I can think about was collaboration because that is something I'm very huge about. Um,
Hmm.
it was just everything lined up and I knew that it was my time. So I filled out this application. It was probably roughly around 15 to 20 questions that I had to answer to
Hmm.
say what would my talk be about. And the fact that it didn't take me any time to write it, I knew it was mine.
Yeah.
I felt it. There were 96 applicants. They broke it down to
Well,
17 of us, and then we went through an interview panel, and it ended up being six, and I made the final six.
wow. And this was in Lima. How far is Lima from where you are now?
An hour.
An hour. Okay. All right. All right. Oh my God. And that just happened just a couple of weeks ago or so. And so it'll be coming out soon. I want people to know. And I'm sure you will have it on the site as well, right? So that we can
Yeah.
actually see it. Okay. So people will go to scottcenteroh.org as well so that people can actually get it there and see it. And really, what was the genesis of the talk? I know it obviously was about advocacy for sickle cell, but what was the genesis? Did it give your backstory and
Yes, basically my journey on how I got here, the story of resilience, and then
mm,
seeing warriors, witnessing the stories of warriors, but also bridging the collaboration piece because my organization is partnered with the Kidney Foundation in Northwest Ohio because
okay.
30% of sickle cell patients will experience some form of kidney disease or impairment
Is that
due to
because of the medication or is that because of the blood disease itself?
it could be contribute to either or.
Mm,
There or anything anywhere there's blood flow, there's an
um,
impact to that. So we
okay.
have to think about that. And
Mm,
that was kind of one of the reasons why I came up with the manual for oral health in sickle cell patients because we don't even think about what that looks like when we're brushing our teeth. What do your teeth look like? There's
mhm,
blood that flows in your gums, so we have to think about if they need blood transfusions before they get their teeth cleaned, or so there's just a regimen, and all of that is on the website too. But
mm.
different things. So when I talk about intersectionality on the things that impact sickle cell patients, that's what I'm speaking about. Anything that will benefit them in the long run or
Mhm.
something that they need to be aware of. I'm pretty much researching.
And that's really what a social worker does too, because you're bringing the resources, whether they need a place to live, they need to know more about finances, they need to know about dental care, oral hygiene, all of those things is what a social worker, anything that impacts them socially.
Yeah.
So that part of it, and then your degree is in the research as well. You're doing what the actual PhD was in what area?
So it's a DSW.
Yes.
It's a
Mhm.
doctor of social work. So mine's is in administration and leadership due to
Ah,
me creating programming and different policies and things of that sort. So I wanted to take a different approach from the clinical aspect. I wanted to be able to bring some other things into the
so policy. So that means that you're probably doing a little bit of I won't say lobbying, but is it like lobbying? Okay. All right. So I wasn't sure if it was lobbying or what. I was like, is it like lobbying? So I can see that. So Tracy says, it says, God's timing. That's wonderful. Congratulations on the TEDx talk. I was look forward to hearing it. Yeah, that's true. Watching it and hearing that is so true. So lobbying and policy, but that really helps too with the organization and the collaboration that you have with all the different groups and organizations. You have a walk. You said you said coming, or it was something you said on there. Some of the events that you have coming up.
Yes, we have a 5K run walk. So it's going to be huge. The last one we did was in 2019. We
Ooh,
had about
okay.
400, we had about 400 people, 40 vendors, lots and lots of sponsors. So we're always looking for people to donate.
Okay. And when is that?
So the event is September 20th from
September
8
20th.
to 12 at Ottawa Park here in Toledo. Yeah.
Egg Toledo. Okay. Well, I have a daughter who is a runner. She does 5Ks.
Oh,
So I will definitely tell her about that. And Toledo is not that far from Detroit. We're like that's like neighbors, right? That's like Detroit to Windsor, Detroit to Toledo. It's like within that same little area. So
yes.
that is good. And so that is like a fundraiser. Even if people can't do the run, they could still do the donating and to that cause as well. And it says she says we need your expertise at the policy table. So what
Yes.
are some of the policies that you would like to see pushed through or advocating for more that I guess you would say that we can change or that we can help push through as well?
Oh, okay. So now you're about to open up a can. So a few things. First, I would love for for there to be a policy on transitioning these patients. Making sure that they have what they need because once they transition from pediatric to adult care, the insurance coverage is different.
Oh,
We're
okay.
Yeah, so insurance coverage is different. Just the services in general to take care because I always say the pediatric system nurtures, whereas the adult system they're dismissive and
Mm,
scared.
that
Um,
is so good. I never realized that because, like I was saying, my daughter was, she was friends with a little girl who, definitely with sickle cell. Growing up with that, it did seem nurturing,
yeah,
very nurturing. But now she's 20, almost 30.
yep,
I don't know what that's like now.
yeah.
It's yeah, you
There's
need
a lot
someone
of
to
gaps.
advocate for her. Mhm.
There's a lot of gaps. So then my other, if I had to, which I'm gonna work with some individuals, but the other one I would love for in vitro to be available for people that want to create families that have sickle cell traits so that we can have, if they decide that they
Mhm.
don't want to have a child with sickle cell, it's not a extreme cost for them because right now it's $20,000 to do
Yeah,
in
I
vitro. So if
yeah,
the insurance companies are paying, then we have less people being born with sickle cell. Like I said, it's a choice. I'm not forcing that on anyone, but at least they will have an
mm,
option to say this
yeah,
is what they want.
right, because $20,000 is not it's
Cheap.
yeah, that's not cheap. That's a really, really good policy to advocate for because I never really thought about that, but that is one of the things. And so your children now, that your 2 boys are how old now?
So 9 and 10.
9 and 10. Okay. So so really, I guess you would say it's part of your mission or part of your calling, because how long is uh, the Scott Center been around?
So Scott Center has only been around since 2022, but I have been doing this work because I used to work for some other organizations, but I've been doing this work since 2016.
Okay. So right after they were born. Right
Yeah.
after they were born. So that is good. I'd like to just say, out of, that situation, like you said, you were heading a different way, but now you're really impacting a lot more people um, because of the work that you're doing, not just in Ohio, but obviously when you do the TEDx talk, that's going to be
Yeah.
that's everybody's going to see that everywhere. But but you're also doing things that are national as well. What are some of the things that you have coming down the pipe that are outside of the region of Ohio?
So I am getting ready. Well, just recently I spoke to over 300 nurses and social workers for Illinois virtually. I provided a training for
Yes, yes.
them. And then this weekend, I am providing a training for community health workers. I didn't mention this. I'm also a community health worker. So that's how I started off as a community
Oh,
health
okay, okay.
worker. So I'm providing a training for them virtually this Saturday for
Hmm.
a sickle cell organization in California. So
Wow, that's in
that's what,
California.
yes. And
Okay, all right.
June, I will be presenting at the FSCDR conference, which is for sickle cell as well as in Florida, the
That's
foundation
important. Hmm.
research. Yes, um, I have a research project that was accepted into their Oxford Journal for sickle cell disease. So this is actually
Congrats.
a publication for them. So I'm super excited about that.
That.
Along with my colleague, Dr. Jasmine Cohen. So we did
Mhm.
this project together.
Oh, that is good. So I want people to know that they can go to scottcenter.oh because she's busy. She's booked and busy. And so if you want to keep up with all the things that she's advocating for, all the people that she's touching, where she's speaking, or you want to bring her in to speak, that is for sure. Go to scottcenter.oh. But you can also go to Speakers Magazine as well. She's in the issue of April as well. And we'll be, yes, there you go. There you go. Yay. We're gonna
Oh,
that's the wrong, yeah, the wrong site. Yes. And so we're gonna embed the when you get the talk, make sure that you give it to me so I can put it in the online issue as well because they go to speakersmagazine.com and we'll have it embedded there on the site and underneath your thing as well. But I just appreciate what you're doing for the community. It's like you're driven. Basically, it's you're driven. It's your mission. You were saying that you happen to run across TEDx Talk at 2:30 in the morning. You're working. It's like, okay, so she likes what she's doing. Most people will be asleep, but people who are mission driven are like, yeah, I think I'm just gonna be up and working. And then that's how God just kind of like, I think it was one of the ones where she said it was just God's timing for you to really have that TEDx opportunity come to you. And like you said, you filled it out right away. And out
I
of the 100 people, 6 of them were chosen, and you were one of the 6. So that is really like one of the things that Tanya was saying. That's awesome. That is so true. That is so true.
I will
Mm.
say I feel that God he's using me as a vessel. This is bigger than my family, it's bigger than me.
Bigger than
Um
Ohio, right? Because you've had an impact in Ohio as well as one of the top 20 under 40,
yeah,
there. Hmm. Hmm.
so I'm moved, I'm driven as you say, but I love what I do and I'm happy that I'm doing something that I love to do. So
That is so good. That is so good. Well, thank you so much for joining us today, Speakers Magazine, being in the issue. You have your copies of your issue as well. If you need more, just always let us know. We had someone else that come on as well, Shirley Miller. She's a psychologist. Looks like she says your advocacy shows in a big way. So that is good. That is good. I love LinkedIn. The LinkedIn family is just pulling in here. It says, don't forget about your recent book chapter. Uh-oh.
yeah,
Okay. So
I forgot it. So I also contribute to 101 social work jobs. So my job was one of the contributions to the book. It's on Amazon.
okay, what's
Yes.
the name of the book again?
It's 101 social work jobs.
100
101. Yeah. It's really good. It's 101 different social workers doing different things, and it tells you how much we make, why we do this work, and
That is
just
good. People
yeah.
don't really know because you say social work and people are like, oh, what do are you out here talking to people all day? That kind of thing. It's like, well, what is a social? So I love that. So they could get that as well. But that's probably on the website. So we want to make sure that people go there, but you'll probably be sending out an email about it as well so that people will know they can go to scottcenteroh.org as well and get that and just send out an email about it. So you got people up here saying, tell them about the
Listen,
salad bar.
I have so much going on. I can't even keep up with myself.
Oh my God. Oh, that's it right here. It says 101 things to do with a social work degree.
Thank you, Brian.
I love that. I love that. 101 things to do with a social work degree. Yeah. Well, the person that I know that had a social work degree, who was my mentor, was Terry Williams. She was a social worker by trade, and she became a publicist in New York, and she handled everybody from Janet Jackson to Miles Davis to Grant Hill, and she's retired now. But yeah, she was a social worker. That was her degree before she actually started doing publicity for Mary J. Blige. I mean, all of the folks, So that is one of the ones. I love that. So they can go get that book on Amazon, 101 Things to Do with a Social Work Degree. Well, thank you so much for joining Speakers Magazine. I really, really enjoyed speaking with you. Is there anything else before we kind of get out of here that you want to make sure that people kind of like want to know?
Well, I would just say if you have a heart, you feel compassionate, compelled to be able to spread awareness and help these patients, please visit scottcenteroh.org/donate. Every
Mhm.
dollar will go toward the cause of sickle cell and advocacy or any type of workshop for these individuals.
I love it. I love it. So scottcenteroh.org. So yes, thank you so much. And we will do that. And don't forget the walk, the 5K in
Yes,
September.
hey,
Uh,
they can't visit. Once they visit the website, everything is right
is
there.
it? There you go. There you go. All righty. Well, thank you so much for joining us today. And we will talk to you later. Bye bye.